Insofern freue ich mich jetzt, unsere dänischen Freunde von der Firma Cortrium, Mr. Eric Paulsen. Congrats. First place, first time in Germany, first victory.
Thank you, vielen Dank. So we have a collaboration with Pfizer in Germany, and they actually pointed out this competition as it could be of interest to us. So they said, this looks really nice for you, perhaps you should apply for the competition. And so we did, and here we are. And my impression of the stage and of the audience was really a good one. Beforehand, I kind of did my homework and looked at all of the judges of the competition, around 20 judges, trying to figure out how should I position my talk in that these are highly professional individuals, a lot of them doctors, a lot of them decision makers in the hospital system. Then our product is this small device. This is an ECG device, and it will do measurements of your body. So not only looking at the heart, but looking at pretty much all of your vital signs. And I think what was really interesting to the judges of this competition is how this solution can follow the patient throughout the whole journey in the hospital system, even from the first contact with the doctor to after they've been sent home of the hospital. So this one could be worn here on the chest by the patient, collect information seamlessly throughout this entire patient journey, and send the information to the doctors and to the hospitals. What we can do is take this device and connect it to an iPad or an iPhone. Right now I'm holding the iPhone, and when I push the button, actually I'm wearing a device right now, when I'm pushing the button I can then see my live ECG and other vital sign information on this iPhone. This information is then transmitted to the cloud so that any doctor sitting anywhere in the world can log in, and he can actually give you the diagnosis of, for example, atrial fibrillation when he logs in and look at this information. So it really doesn't have to be that complicated, and a process that would usually take long. By using this technology, you can get a diagnosis instantaneously. We're doing a lot to make sure that other companies can work with us. So we have what is called an SDK, a software development kit, where all the other companies can develop both for our Android and iOS if they want to get the connection to the device in their own app. Furthermore, we do a lot to use open standards so that hospital systems or clinical systems can get the data out of our cloud solution without any hassle. What I'm holding in my hand is a prototype. This is actually 3D printed. We will have the first batch of devices, the finalized product of the assembly line in January, and we are launching in the German market already in April in 2017. At this point of time, we will also have the CE certification and approval for this device. So this is really interesting times for us.